Good evening to Padma Bhushan Dr. Devi Shetty, Chairman and Founder, Narayana Health. Good evening, sir. We have few of our members and the Health Committee members who have joined us today. On behalf of the Federation of Telangana Chambers of Commerce and Industry, I, Khyati Naravne, I am the CEO at the FTCCI. It takes great pleasure to welcome all the members as well as our chief guest to this program today. For the information of you, sir, this is we are on our 106th year journey, and primarily our role is to support the industrial ecosystem of Telangana, the MSMEs, the enterprises, the startup. So we operate through 20 expert committee, and healthcare and disaster management is also one such committee that we work very closely with. And this program is organized under that committee. And sir, we also have a 3-minute video of the FTCCI, which will give you an overview of what we do. And we would like to show you that film before we begin the session.
1917, the year when a dedicated organization, the Deccan Chamber of Commerce, was formed to encourage trade and commerce activities. The historical journey of the organization has witnessed great transformation as per the changing needs of the industry and businesses. The Federation of Telangana Chambers of Commerce and Industry, FTCCI, a legacy of excellence, voice of the industry, representing interests of over 25,000 businesses of all sizes, sectors and regions, is empowering industry and trade of Telangana state. A world leader in pharma, a global hub for vaccine, home to all major MNCs, leader in IT exports, an emerging first star of India. FTCCI advocates a pro-business environment, caters to the needs of MSMEs, budding entrepreneurs and traders through its advisory services in taxation, market information, industry-related issues, B2B connection. The Chamber has its nominees in the state-level advisory committees to help drive business productivity. FTCCI aids in providing certificate of origin for exporters, issues visa recommendation for business travels. The Federation imparts job skills through its dedicated skill center. It has adopted 14 government ITIs to improve the employability of students. With a uniquely global perspective, the FTCCI events reach a highly engaged audience, policymakers and stakeholders aiming towards Atmanirbhar Bharat.
FTCCI to work with government, tell us and guide us कि हम लोग क्या कर सकते हैं to remain competitive, to remain better than our competition. FTCCI for joining us, and I thank the office bearers of FTCCI for inviting me. Jai Telangana, Jai Hind.
Come and be a part of this dynamic and proactive organization. Together, let's realize the vision for a progressive future.
Thank you so much. We have Mr. Anil Agarwal, the president of FTCCI with us. Mr. Shekhar Agarwal, chair of the healthcare committee. Dr. B.R. Shamana, professor, School of Medical Science, University of Hyderabad. Mr. Meela Jaydev, he is the senior vice president of FTCCI. And a few managing committee members and committee members of the health committee. So I request Mr. Anil Agarwal to please welcome the gathering.
And she is our CEO, Khyati Naravne. Yeah. I welcome you all to this program on Vision 2030, Quality and Affordable Health for All, Telangana. Sir, we are honored to have you, sir. As a Padma Bhushan, Dr. Devi Shetty, he is the chairman and founder of Narayana Hridayalaya as our chief guest, and Dr. B.R. Shamanna, Professor, School of Medical Sciences, University of Hyderabad as guest of honor. Sir, your contribution to healthcare industry is immeasurable. It is exemplary. And we are grateful to have you to address our members today. And sir, no doubt you are virtual, but I think that is more important that you are addressing our members. With your vision, you have already touched millions of lives, sir. And you are champion of affordable health for all, affordable and quality health for all. We have heard so many videos on YouTube about the health, especially regarding heart health. Welcome you once again, and we are very delighted that our members are getting benefited. Dr. Shamanna is our guest of honor today. He is a highly accomplished medical professional with extensive experience in public health and disability inclusive development. He is known for his expertise in health and welfare economics, politics in healthcare. We are honored to have you. Thank you. Thank you for joining us. I hope this roundtable will have a fruitful discussion. Basically, a lot of inputs from our Dr. Saab, how the health can be maintained, especially regarding heart. And quality also is important, and affordability is also important. So, thank you, sir. Welcome once again.
Thank you so much for setting the context. I now invite Mr. Shekhar Agarwal, Chair of the Healthcare Committee, for his theme address.
Our chief guest, Padma Bhushan, Dr. Devi Shetty ji, our guest of honor, Professor Shamanna ji, Chair Vision 2030, Dr. Dwarkana ji, Director and Head Health Vertical, Dr. Subodh ji, our Dynamic President Anil ji, Senior Vice President Jaydev ji, CEO Khyati ji, Rakhi ji, Advise, and Bijon ji, and Alexander ji, and Nagaraja ji, Managing Committee members, past President, friends and media, a very good evening to all of you. Friends, God comes to the planet in form of a human being. Now it has come in the form of Dr. Devi Shetty ji. He and his hospitals have never denied even a single patient because of no money with them. Sir, we are really grateful on behalf of all the citizens, not only of India, but of whole world. Today is the happiest day for us, sir, and to have the messiah of quality and affordable health for all with us. Sir, your belief that if a solution is not affordable, then it is not a solution. If a solution is not affordable, then it is not a solution. Let it go with each and every one of us till the time we are on the planet. Can we acknowledge the presence of Dr. Devi Shetty ji with a big round of applause? We are also very happy to have Professor Shamanna ji as our guest of honor. He's a highly learned person, always been very encouraging and supportive to us. Can we welcome Professor Shamanna ji again with a round of applause for being us? Friends, as you know that the healthcare sector, there is a wide gap between the demand and supply. There are many ways to address the gap. The Federation, along with its like-minded partners like LV Prasad Eye Institute, AIG, IMA Telangana, Administrative College of India and others, is very committedly working to address this gap. First, by creating a vision document, that's Vision 2030, Quality and Affordable Health for All, Telangana. Many experts from different domains and specializations are most dedicatedly working on this great mission. Dr. Shetty ji is the messiah with a great purpose in his life. Sir, we shall be grateful if you may kindly include and guide us on the following points to take or to make healthcare more patient-centric and more affordable. First is increasing awareness about healthcare in schools and colleges through its regular educational curriculum. Second is promoting and strengthening healthcare system through public healthcare, also public-private partnership and also involving standalone clinics, polyclinics, nursing homes, small hospitals, and trust hospitals. Third is providing healthcare for financially low income, middle income, and high income group. Fourth is improving the existing healthcare education. Fifth is importance of innovation and technology. Then patient-centric government policies, examples of good practices, economically sustainable and viable models, rebuilding community trust on healthcare systems and health force. The most important is addressing the gap between the resources available and the resources required in terms of manpower, infrastructure, technology, and investment. Fourth is observations on Ayush and how it can benefit the citizens. Sir, we assure you that our team would work most committedly with your guidance to make our Telangana, our India, and our world a better place to live. 2 lines for this Messiah of health, Dr. Shetty ji. Woods are lovely, dark and deep. Woods are lovely, dark and deep, but I have promises to keep, and miles to go before I sleep, and miles to go before I sleep. Friends, again, one big round of applause for Messiah of affordable health, Dr. Shetty Garu. Thank you, good luck, and goodbye.
Thank you so much, Mr. Agarwal, Mr. Shekhar Agarwal. And I now request the committee member of our healthcare, Mr. Hari Govind, to please introduce the guest of honor.
Good evening. Thanks to Shekhar Bhai, first of all, and our President Dynamic, Mr. Anil Agarwal, because they have Guru Gobind ko mila hai. So, and here, Mr. Shamana is such a person who is like that. So, good evening, everyone. I would like to introduce our guest of honor, Professor B. Shamana, an eminent medical professional and accomplished educator at the University of Hyderabad. He has an impressive track record, having served with the International Council for Control of Iodine Deficiency Disorders. Professor Shamana contribution to the development and implementation of 2 large WHO collaborating centers for prevention of blindness in India are highly regarded. He is a visiting faculty member of the Masters in Public Health Eye Care program at the London School of Hygiene and Tropical Medicine since 2002. His vast knowledge encompasses health and welfare economics, disability inclusive development, and politics in healthcare. Professor Shamanas has received many grants from national and international organizations and was nominated as an eminent person to the governing board of the National Institute of Health and Family Welfare in November 22. So this is Guru Shamana. Thank you.
Over to you, sir.
Good afternoon, everyone. Thank you very much, sir. First and foremost, it's a privilege and also a pleasure to be the guest of honor for this roundtable, Vision 2030 Quality and Affordable Health for All. I think the perseverance of FTCCI and especially Shekhar Agarwal, sir, has been profound. He made sure that I would come and I would participate in this. Thank you very much, madam, and thank you very much, President, sir. Mr. Mela Jaidev, I used to know his father very well, and we had the opportunity of working with Sudhakar PVC pipes in Suryapet. Sir, thank you very much. Raju sir, Subodh, and Raki madam, and thank you very much for the kind introduction. Sir, I think I've had the pleasure of listening to you quite a few times, but this is going to be a little different from the point of view of listening more carefully than what I used to do in the past. So thanks for making time for us, sir. I presume a couple of points which I want to make before I want to hear from you more is the fact that I think sort of encompassing this Vision 2020, Vision 2030 quality and affordable healthcare for all Telangana is the whole issue of reaching the unreached. I think we still have equity issues with respect to health, and some of the equity issues partially have been addressed, but they still exist in terms of whether it is geographical, like a state in Telangana has a lot of tribal populations, the particularly vulnerable tribal groups. I think we need to look at how do we reach them. So we have issues of equity related to geography. We have issues of equity related to gender. And, evidence to that effect has been the fantastic institutional deliveries increase close to 95% in the state of Telangana, because to a large extent, we've been able to also look at gender related issues, but the utilization of healthcare services, and especially at the district level and above, and also preventive programs, etc., is much to be desired. And we'd like to have a roadmap for that as well. Not to mention the socioeconomic status for which you have set the sort of ball rolling long time ago, because I had the pleasure of studying your Yashaswini Farmers Cooperative Insurance model in the state of Karnataka. And I know how it provided the benchmark for a lot of other programs. We were in the United States of both the states of Andhra and Telangana. It would be wrong to say USA, but with both Andhra and Telangana, I think the stage was set to have this large-scale Arogyashri program, which has paved the way for many other states also coming in to address the issues of health financing. I think if we address these three equity issues, the geography, gender, and the socioeconomic status, we can make a difference. And related to which we have a very good framework, the WHO Health Systems approach, which looks at service delivery, human resources for health. Again, you're a pioneer in suggesting some issues related to how we can bridge the gap between the demand and supply, especially HR. Health financing, where we are now at least able to look at bringing down out-of-pocket expenses to less than 50%, 48% as I speak. Governance and leadership, we'll need to work more on that, leveraging information, communication, and technologies. And last but not the least, having access to drugs, devices, vaccines, etc. We are sitting in Hyderabad, and I think we can make a large dent in terms of making up. And COVID-19 has proved to be what we can do, sir. So look forward to hearing from you more. And I think it's a pleasure again to be part of this very illustrious and eminent hardworking group of Health and Disaster Management Committee of FTCCI. Thank you very much, and look forward to hearing from you, sir.
Thank you. Thank you.
Thank you so much, sir, for sharing your thoughts and ideas and all the suggestive measures for reducing the gap. And well taken. And we now move forward. And I would request the co-chair of the Healthcare Committee, Ms. Rakhi Kankaria, to please introduce the chief guest.
A very good afternoon to the head table. And a big thank you to all the members who have joined us on online, members in this room, and media persons. Dr. Devi Prasad Shetty, Chairman Narayana Hridayalaya, needs only the appreciation of all of us, and the extent is unlimited. We've heard all the leadership on the table speak about him. Yes, a cardiac surgeon of repute and a successful entrepreneur, Dr. Shetty is a highly respected luminary for his ingenious ideas for reforms in healthcare sector. His visionary leadership to make quality healthcare affordable for all has drawn global recognition. Dr. Shetty is the founder and chairman at Narayana Hridayalaya group of hospitals, which has been an interesting case study for the likes of Harvard Business School and the Wall Street Journal. Dr. Shetty is a recipient of several prestigious awards, including the Padma Bhushan, the Padma Shri, the Economist Innovation Award, Financial Times ArcelorMittal Boldness in Business Award, NECI Asia Prize for Economic and Business Innovation. He has also been awarded honorary doctorates from University of Minnesota and IIT Madras. I wouldn't keep the audience further away from hearing Dr. Shetty. Looking forward to your session, sir. The house is open.
Thank you. Thank you so much. Thank you. I'm extremely grateful to all of you for giving me an opportunity to interact. And I hope at the end of this meeting, we will be able to come up with some type of action plan which can set a benchmark for rest of the states to follow. First of all of us are very familiar with the slogan that healthcare is expensive. The cost of healthcare has to come down. I will just give you one example of how much cost has come down in healthcare in this country. Let's take the example of heart surgery. I left England in 1989. And the first patient I operated in Calcutta, B.M. Birla Heart Research Center, the first patient I did the bypass 33 years ago, paid 1.5 lakh rupees. That was the cheaper rate for a bypass grafting. Elsewhere, those days in Bombay, it was more than double this amount. Today, we are doing the same operation under the government scheme for 90,000 rupees. Tell me what was 1.5 lakh rupees 33 years ago is 90 lakh rupees, 90,000 rupees today. So driving the cost further down, I'm not talking about the cost of corporate hospitals with all the ambience and the affluence they have, what they charge. I'm talking about the prevailing rate in a common hospital. If you try to drive it down further, it will only happen at the cost of quality. Now, we need to dramatically think differently about healthcare. Otherwise, we will keep on making the same mistakes. I will give you one number, what is very relevant for us to analyze. India, according to Lancet Commission on Global Surgery, requires 65 million surgeries a year. And today, India is performing 26 million surgeries every year. Now, what happens to the remaining 40 million surgeries? Most of these patients gradually suffer and die, and they die because of lack of access to simple, safe surgeries. I'm not talking heart operation or a brain operation. I'm talking about 3 types of surgeries called bellwether surgeries. And these bellwether surgeries are surgery for cesarean section for obstructed delivery, and laparotomy or opening the stomach for a burst appendix, or surgery for a compound fracture. This type of surgery comprises more than 70-80% of the procedures, and that is not available to most of the country's citizens. Now, why that is not available? Is it because we don't have hospitals? No, it is not because of that. Our hospitals can triple the number of procedures with the existing infrastructure. Is it because we don't have doctors and nurses? No. There is only one reason. Everything what is possible we have provided, but we have not provided a financial intermediary to pay for the healthcare. Now that is the missing link. Now, what is the financial intermediary? In simple terms, you can call it as a health insurance program for the working class and the poor people. That is missing. Now, I'll give you one example why this category of people need a affordable health insurance for the family. Now, when I talk about a health insurance for the working class person, let us start with a family which earns about 30,000 to 70,000 rupees per month. Let's look at that category of people. I believe this section of society, which is called as something like a missing middle, comprises about 200 to 300 million people. Now, if you have a health insurance with a premium of 10,000 rupees per year, which should cover the primary, secondary, and tertiary care, we have won the battle. And 10,000 rupees per year is not a large amount of money because these families are already spending more than 21 to 25,000 rupees every year. And they get nothing in return. Why I am pegging at 10,000 rupees? I will give you my experience happening in my hospital every day. About 14% of the heart surgery done in India is done by our group across the country. And a typical patient of mine is a little baby on the mother's lap. And after examining the child, I will tell the mother that you require a heart operation. And they have only one question, that is how much it is going to cost. If I tell her that it is going to cost 2 or 3 lakh rupees, she has no answer other than crying. The whole family starts crying. They start begging. In the end, when they leave my office, the lady will come around and tell me that Ami 1 lakh dete pari. I can give you 1 lakh rupees for the heart operation to save the child's life. Now, I just want to look at it differently. If today we are all considered as privileged society and we constantly blame the government, that government's responsibility to offer the healthcare to the citizens, and they haven't done what they are supposed to do. We take a shelter in that. But imagine this lady is offering me 1 lakh rupees for the heart operation. If I have a health insurance where the premium is 10,000 rupees per year, that means this lady has enough money to pay the premium for the health insurance for the next 12 years. Not 1 year, next 12 years. Now, who has to provide the health insurance? Is it the government? No, government cannot do that. People like us can do that. But we have never thought in that direction. The whole attempt was to say that the problem of a middle class and a poor person should be resolved by the government. But we take all the benefits from the government. So why we need to do it? The reason why we need to do it is because from the day of independence, our government has been repeatedly saying that we will offer health care for all the citizens free of cost through taxpayers' money. That is the ideological belief everyone endorsed, and all of us thought that one day it will happen when we become a rich country. But if you go by the data of the countries which have successfully offered universal healthcare free of cost to all the citizens, you will realize that we are living in a fool's paradise. Because the countries which have offered universal healthcare for free have 3 common traits. All these countries are small countries with a population of 10 million, 20 million, 40 million people. No single country in the world which is large was able to offer universal healthcare for free to all the citizens, including United States of America. They cannot afford it. Okay, that is the first criteria. Second criteria, all these countries have a huge tax to GDP ratio. Their tax to GDP ratio is invariably more than 25%, going up to 45%. And in India, our tax to GDP ratio is 11%, 11.2%. And the third feature with these countries is that all of them are spending today more than 10 to 18% of the GDP on healthcare. and we are only spending 1.2% of the GDP on healthcare. We simply cannot afford to increase it. So when the data is so clear that taxpayers' money cannot pay for the healthcare, we have to look at an alternative. Now, what is the alternative? The alternative is a health insurance. But when we talk about the health insurance, all of you have your own reservation because of the limitation of the current model of health insurance. What is the problem with current model of health insurance? In health insurance today, there are three stakeholders. One is the hospital. Second one is the health insurance company. And the third one is the patient. These are the three important stakeholders. Now, sadly, the health insurance company doesn't trust the hospitals. Hospitals do not trust the health insurance company. And the patient doesn't trust both parties. So you have three stakeholders in this game of health insurance, and these three stakeholders do not trust each other. As business people, you all know that in any business, if the stakeholders do not trust each other, the whole business scalability will not work. And what is the other problem? The patient today, in the current scenario, has to pay for the profitability of the hospital, and he has to pay for the profitability of the health insurance company. Essentially, they should look at the profitability of two separate large businesses. Whereas, if the hospital becomes a health insurance company, the entire rules of the game will change. Why this has to happen? This has to happen because as a doctor sitting on this chair, when I tell the patient that you need a bypass grafting, first thing what comes to patient's mind is it really required? Or this doctor is saying I need a bypass because he can make some money out of me, right? Whereas if I become a health insurance company and tell him that he requires a bypass grafting, there is no conflict of interest. The patient knows that I'm going to pay for the bypass. So obviously I will not be giving him a wrong advice. So the whole concept of lack of trust, conflict of interest will be addressed when the hospitals become a health insurance company. And this is what we need to work towards. Now, other reason why health insurance is very important for working class people, middle class people, is because in reality, a person drawing 60,000, 70,000 rupees cannot admit his father or a mother to a ICU or get them to undergo a bypass grafting or a brain operation. They cannot afford the cost of healthcare, but they can afford cost of health insurance. So when you offer a health insurance with a premium of 10,000 rupees to 15,000 rupees for a family, what you have in turn have done is to offer them services in healthcare up to 20 lakh rupees or 30 lakh rupees. The whole concept of their ability to pay changes when you have this type of a financial intermediary called health insurance come to the front. Now, our aim is that this health insurance should cover the primary healthcare, very, very important. The reason is Today, almost all the health insurance companies do not cover the primary care. And more than half of the family's expense in healthcare happens outside the hospital. And because there is no outside the hospital coverage by the health insurance company, families keep on paying the premium for the health insurance, but they do not get the benefit. Because how many of us need to be admitted to the hospital? How many of us will need to be, hardly 5% of them will need the benefit. So they do not appreciate. Whereas if you cover the primary care as well, then more than half of your members will get the benefit of paying the premium through the primary care. So we believe that for the entire family, if they pay 10,000 to 15,000 rupees premium per year, if we can offer them about 10 lakh rupees of cover for the family of parents and children, 3-4 children or whatever number of children, for multiple admission, and for a single admission, say for a bone marrow transplant or a heart transplant or a kidney operation, we may pay up to 20 lakh or 30 lakh rupees. It should be possible. But our challenge is not offering them these services with 10,000 rupees, 15,000 rupees. Our challenge is, how do you convince or provide these people the premium of 10,000 to 15,000 rupees to be paid in one go? Now, we are now looking at how do you help these missing middle families to pay the premium. Now, there are many things we can do, which has been done in other parts of the world. And this is the main reason why I agreed to address all of you. What we should do is first look at the unorganized sector of employment. More than 93% of the employees in our country are working for the unorganized sector. The maids, drivers, gardeners, and people working in a household or small industries, they do not come under the organized sector. And they are the 93% of the workforce. Now, there is a concept called health saving account. Health saving account is practiced in US, practiced successfully in Singapore, and I think in China. Now, any contribution made to health saving account is tax deductible. You are aware that I think 15,000 rupees per year for the health insurance is already tax deductible. Okay, so I'm not talking about creating something which is for which a regulatory requirement is the regulation is required. It is already there. Now, my suggestion is, you're all running industries. You will be able to analyze this much better than I do. If anyone who hires another person for a month or 2 months or one long term, whatever, if we say that every unorganized sector person will have a health saving account, there is a bank account which is controlled by the health insurance company. And every employer of unorganized sector should contribute just 100 rupees per month minimum to the health saving account. And if the employer is happy, they may contribute 500 rupees. Or during festival, they may give them 1,000 rupees, whatever. But you have 12 months to collect this premium of 10,000 or 15,000 rupees. With the working class people, if you ask them to pay 10,000 rupees upfront, they don't have the money. Now we should create them an avenue to save the 10,000 rupees over a period of 1 year. And you should incentivize them saying that, and introduce them to health saving account, saying that you have to create a health saving account in an insurance company. And whatever, and your employer must contribute 100 rupees per month, minimum. Why 100 rupees? It should be more than 100. It should be about 300, 400 rupees. But the moment you increase the amount, the payer, the employer will be unhappy. And the moment they are unhappy, they will make sure that this policy won't work. Keep it with 100 rupees. Maybe later on we can keep increasing. The moment we start this, 93% of the workforce of the country will come under the organized sector because they have an account and everybody knows how to interact with them or deal with them. So this is something, if we can start with a policy that every resident of every employer, maybe I'm hiring a housemaid or maybe I'm hiring a driver. If we have the concept that all of them should have a health saving account, then you have introduced them to the concept of health insurance. And you have introduced them the habit of saving for the health saving account. So the whole approach towards the health insurance will change. Now, I'll just give an example. The small scale insurances, how it can make a difference. In 2003, we convinced the Karnataka state government to launch a health insurance with a premium of 5 rupees per month for the farmers. And that was covering them only for the surgeries. We had 4.5 million farmers paying 5 rupees per month. Fortunately, government of Karnataka agreed to become a reinsurer if a Yashaswini trust has a financial problem. And at the end of, I think around 12, 13 years, 1.21 million farmers had varieties of surgeries. And 1,31,000 farmers had a heart operation. All this happened by each member paying 5 rupees per month. This is the beauty of a country with this many population. So essentially, I believe that India will become the first country in the world to dissociate healthcare from affluence. India will prove to the world that the wealth of the nation has nothing to do with the quality of healthcare its citizens can enjoy. And India will do it within 5 to 7 years' time. Now, for this to happen, there has to be an affordable health insurance for the missing middle. And that will not happen unless we create a concept of saving through health saving account. And this will not happen unless one state with the passionate people makes it happen, then automatically all the other states will follow. This is how we did it in Karnataka state first. Then I had the privilege of visiting when Dr. Reddy was the chief minister of Andhra Pradesh. I went there and made a presentation. They started the health insurance. Tamil Nadu started, then Maharashtra started, then Gujarat government started, all these state governments started. So if now today, if Telangana can take the initiative in creating the health saving account, let's start with something, right? Then I believe it will follow, all the others will follow. This is my request. And once again, I'm a very optimistic person. I just want all of you to know, we are an amazing country where in a limited short period of time, we do amazing things. Today, our online payment is transferring largest number of transactions, more than China and US put together. And all this happened in a 3-year period. We have democratized mobile communication. the richest man and the poorest man uses the same tower, same bandwidth. Maybe he has a cheaper handset, but the technology is the same. The richest man living in the mansion and the poorest man living in a slum watches the same TV program, same entertainment. So we are in a position today to show to rest of the world that our wealth has nothing to do with the quality of healthcare our citizens can enjoy. Thank you so much.
Thank you so much. We've heard your TED talk a few years back, and we can say that you are as passionate then as passionate now as you were then. And totally, I think you have, time and again spoken about the health saving account, which I think for the missing link and the unorganized sector, which is a key. So definitely, I think the healthcare chair and the committee member have a task to get it introduced at some point to Telangana as well. And sir, you also, doctor, you also mentioned about the significance of the financial intermediary hospital to become health insurance company as well. So few of the suggestions that you have, I think, set context right, and I think it has somehow given the committee to think on those lines, and we are also coming out with our vision document. So it's really going to help us. And Shekharji, if you would like to add some.
It's a great listening to you, and we understand that something will do, and Telangana will certainly, your guidance will take a lead, and we've got to, your very good friend Bijonji is there, and he did a good program on health insurance, and will be taking it forward. And anytime anything we stick up, we'll certainly seek your guidance on that. Thank you very much, sir, for your guidance, and we'll take it forward. Yes, told about health insurance account. Yeah.
So, do we have time to take a few questions? Doctor, can we take a few questions, or what do you suggest?
Yeah, I can take 2 questions. Yeah.
2 questions. Okay.
We have actually Dr. Dwarkanathji is there. Dr. Dwarkanathji. Can we have Dr. Dwarkanathji online?
Yeah, good evening, Dr. Devi Shetty. I'm Dr. Dwarkanath Reddy over here. And it's a enlightening presentation by you, giving in the context that the importance of the simple things that has to come into the system. And we are sure that because we are on basis of this only, we are making a document. I think definitely this will help us. We take forward, and recently the FTCCI has done a big sort of a section on this insurance, the companies. I think they will take this forward, and we will be adding all this into our document. Thank you very much, Dr. Devi Shetty, being with us for this important presentation. Thank you very much.
Thank you. Thank you.
Sir, so nice to hear you, sir. So insightful. This health saving account, sir, I am contemplating to open one health saving account for our federation staff now.
Thank you.
And in our industry also, I think we should, I am seriously thinking now, sir, a good input we have got now. So nice, sir. Thank you.
Thank you. Thank you.
Sir, my name is Ram Chandram. I'm a public relations practitioner. You mentioned that hospital should become health insurance companies. Could you kindly throw a little more light on this, sir?
Today the health insurance company are standalone companies, and the moment a patient with the health insurance policy goes to the hospital, some hospitals like to take advantage of the premium because they are covered for 2 lakh or 5 lakh or 10 lakh rupees. Whereas if the hospital themselves are health insurance provider, then they will be careful in advising them right treatment. And more than that, one main reason why hospitals should become a health insurance provider. As I said, 14% of the heart surgery done in India is done by us. More people develop heart attack, it is better for my business. I have no incentive to keep people healthy, so they do not develop heart attack. Now, once I become a health insurance company, I will be working very hard to make sure that nobody develops the heart attack. The conflict of interest will be addressed the moment the hospitals become health insurance company.
Hi, Doc. It's nice to have you. I wish I had a jet to fly you into Hyderabad and fly you out. Unfortunately, I can't afford one today. But the day I have, I like to have you in Hyderabad physically.
Thank you.
So good to hear you. You see, I want to tell you, way back in 1956, Pandit Jawaharlal Nehru visualized something called ESIC. I don't know whether you all have heard about this law or not, which makes it mandatory in our country that if anybody is earning less than 21,000 rupees per month, gets covered not only for himself, the whole family, not only primary, secondary, tertiary, even specialty. So my contention is, if that model has worked in the country, where the people have paid for it, it's not coming free. And today's government is sitting tight on more than 8,000 crores of rupees under ESIC. They don't even know how to spend that money.
Sorry. It is not 8,000. It is more than 90,000.
Yeah, okay. It's okay. I stand corrected.
Yeah.
I stand corrected. But what
90,000 crores. Yes.
So what I wanted to tell you in brief is, money can come very comfortably, but we have to understand that how to have imagination to use that money efficiently and effectively. And that is where India has a challenge. You see, we have a lot of money lying around. And when I spoke to the Director General of ESIC about 3 years back, who is today the Chief Secretary of Gujarat, I still recall he's telling me that people do not want to register their people under ESIC as employees, only because of this healthcare cover. Now, that is one unfortunate thing. But the present government in India, under Modi's leadership, has made it quite inclusive and expanded the parameters of coverage. So today, even an unorganized labor can come under ESIC in the country. So can we look at that model, number one? Number two, can we look at, not hospitals getting into insurance business, because that can become again dicey. That if everybody starts getting into business, like we don't want government to get into business, we don't want insurance companies to be managing hospitals. I mean, this is my personal thought. They should focus more on good quality healthcare, how to make it affordable, how to make it accessible. Let the insurance business be with the insurance companies who are meant to do that business. But anyway, I mean, what I get from you is there are competent people in the healthcare business who can run a good insurance business. So we are waiting to see that happen, and that will be a good idea. And you, of course, have shown some pathway with Karnataka government, with the farmers. So how we can take that forward. But the most important thing is Jan Dhan account got inclusive in terms of giving insurance in accidental death and also insurance cover on a minimum insurance payment of 20 rupees per year for accidental and 360 rupees per year on life insurance. And that has shown a huge increase in terms of people getting recruited under those insurance covers. Similarly, we can think of how we can, on our own in Telangana, develop a model and make it inclusive in a manner that the missing middle class gets into that cover. and how we negotiate with insurance companies to get a best kind of a deal, because we're going to give them a large business. So I would appeal to FTCCI president, then when he is negotiating with insurance companies, it has to be not only realistic, but a hard negotiation. And when we do a hard negotiation, we'll definitely get the best in terms of that negotiation. And I will definitely play my role on behalf of the patients with the collaboration of FTCCI. Thank you very much.
Thank you so much. Thank you. Thanks. Thanks.
Sir, I have a question. I'm Dr. Vishnu Bharadwaj. I'm a young medical graduate. Sir, are there any financial models to identify decrease in cost when preventive measures of health are followed? And if so, can such actions be rewarded while taking an insurance? Like if I follow like regular preventive health protocols, such as regular checkups, regular workouts, maintain a healthy food, healthy sleep, we have devices that can track them. So can they be incentivized into insurance so that I would pay less premium?
Yeah, all these things are possible provided there is a health insurance. Today, a tiny percentage of the population, especially those who can afford to pay, are the ones who are buying the insurance. They don't need the insurance. They just buy it for tax saving or other reasons. So once people who can't afford to pay for the health care buy the health insurance, then everything what you're talking about can be implemented.
Thank you. We now move forward and I request Dr. Subodh, Director from ASCI, for the concluding remarks.
Thank you. Dear Dr. Devi Shetty, it's been an absolute privilege and honor to hear you. I've been hearing you for the past 20-30 years. And I think it's the same passion. And thanks for bringing out important issues of accessibility, affordability, and also importance of the primary care. I think coming from a corporate hospital, I think talking about primary care and inclusion in insurance is very extremely important. And let me also tell you, I think Dr. Shetty has not really touched upon in this talk, but he's a very ardent believer of technology in healthcare. I have understood that he now does video consultations. So he's actually moved behind how technology can play great things in the healthcare. Very important. I think this is the same thing which Niti Aayog has also been grappling with, the missing middle class. And thanks a lot for bringing out this entire issue of middle class and how to bring them. And we all know that the missing middle class, if they fall ill, they're going back into the poverty line. So the very important area of thing which actually you have raised. And we are doing this vision document along with FTCCI, along with ASCI and other institutions. And this is going to be a great opportunity for us to talk about the health saving account and how to take it forward. And I'm very, the comparisons of universal health coverage. We all talk about Thailand as an excellent model of universal health coverage and have already achieved universal health coverage. But now you understand India with so many states and union territories, the comparisons are not really possible. So I would like to also thank the entire thing. I really was impressed with this unorganized sector getting into the organized sector, because that's the best way of through this health saving account. So thanks a lot for a wonderful lecture which you gave to all of us, and I'm sure all of us have benefited. And I would also like to thank Dr. Shamanna for giving that introductory remarks, because he's a pioneer of a field-based primary care and economics, being a physician himself. So thanks a lot for this wonderful session.
Thank you so much, Dr. Subodh. And over to Mr. Meela Jaydev, Senior Vice President, to propose the vote of thanks.
Yeah, thank you very much, Kathy. First of all, thanks to Dr. Garu. Since so many years, I'm listening the doctors. Is the affordable operation will done only Narayana. Really, I'm telling. My native place is Suryapeta. So many people are coming to their Apollo and other hospitals. After that, they gone to Narayana. It is very, very best hospital and best diagnostic. They told, so many district people has told me, sir. Hats off you, sir. Thank you very much for that. On behalf of FTCCI, I would like to extend of thanks of all of our participating in the roundtable meeting Vision 2013, quality affordable health for all. We are extremely privileged to join Padma Bhushan Devi Shetty Garu, Doctor. are thankful to sharing valuable insights and thoughts and topic accessible, affordable healthcare. I would like to express my heartfelt thanks to B.R. Shamanna Garu. He is my father's friend. Just now I am listening from him. Our guest of honor for gracing of the event, for the sharing of his experience. I would like to thank you, Alexander and Nagaraju and FTCCI team, invaluable support to the contribution towards the making summit success. Finally, I would like to thank you all attendees for their activist participation. Thank you, President Garu and Kathy and Chairman Garu for attending, and thank you very much giving the good guidance to me. And thank you once again to joining today for your commitment achieve our goal accessible, affordable health care for all citizens in Telangana. I'm requesting you to all what the doctor is tell every one person has to be insured. That's more better. When पानी जब पीने का है तो जब ये बॉडी नहीं खोदने का है. पहले बॉडी खोद के रखना, पानी जब होना जब बॉडी. मेरे को हिंदी थोड़ा प्रॉब्लम है. You always ready to like that. దాహం అయినప్పుడే బావి తోడుకోవాలొద్దు. ఎప్పుడు బావి రెడీగా ఉండాలి, మనం నీళ్ళు ఎప్పుడైనా తాగడానికి రెడీగా ఉండాలి. అలానే ఇన్సూరెన్స్ ఎప్పుడు రెడీగా ఉండాలి.
Sir, your branch office in Hyderabad, Narayana, Rudayalaya, will be grateful. Yes, sir.
Thank you so much, and we look forward to your physical presence. And please keep us posted if you're visiting Hyderabad. We would be happy to come and meet you personally. Thank you once again. Thank you.